Hello, everyone. In case you're curious about the first day of clinical, you have the first day of clinical coming up. Maybe you're thinking about going to nursing school and you'd like to know what happens at clinical. I wanted to answer kind of some of these questions as universally as I can because every school's a little bit different. So these are just what's universal. A little bit of background about me. I teach LVNs. I'm a nursing instructor. I've taught it for quite a while now. I thoroughly enjoy it almost as much as I did being a nurse in the beginning and actually doing direct patient care. So that's who I am. What I would want to say the first day of clinical, everything starts out at home. I would always leave as early as you can because what happens is people don't know how to get there. People don't know where to park. People don't know how bad the parking situation is. Maybe it's street parking and you don't know if it's going to be hard to find a spot or if there's spots everywhere. I would get there extremely early the first day. So a lot of schools have some sort of attendance policy where there's some sort of a repercussion for being late. We don't want nurses showing up late. If you're late in real life as a nurse, that means the shift before you can't go home on time. So if you're in the morning and you start at 6:30, which is a typical clinical start time, if you are a real nurse that was supposed to start at 6:30 and you show up at 6:45, that night shift that has not slept has to stay up for another 15 minutes and they're exhausted. So you don't want to do that, okay? So there'll be some sort of a repercussion. It's different every school. One of the schools I worked at, if you show up even 1 minute late, they would send you home for the day. You have to make up the entire day of clinical, which you're a nursing student, you're tired, you don't want to do that. You don't have time for that. So you want to make sure you're there extra early. After that, people generally meet up. They'll kind of show you around the facility. They might show you later in the day. They might show you earlier in the day. But you have to learn where things are. So any site you go to, in the orientation, things you want to mentally note or keep in mind would be where all of their crash carts are. So how do you know it's a crash cart? It'll say crash cart. It'll be bright red, or you'll see some sort of oxygen or CPR board. So it'll have a big metal tank on the side of it, or a big red flat, it almost looks like a boogie board, so that if somebody crashes, they stop breathing, you stick that board under them. Okay, so it doesn't matter if they're on the bed or wherever, you can have a hard surface to do CPR on. That would be cues that it's a crash cart. Another thing you're going to want to keep in mind where the oxygen room is. And all facilities will have some sort of an oxygen room, some sort of a place where they store the oxygen, so that if in case of an emergency they need oxygen right now, you're not sitting and thinking, well, where was it? Where am I supposed to look? Other things you'd want to see, where the nursing stations are, where there's bathrooms for you to use, where there's bathrooms for you to wash your hands, or where there's a sink to wash your hands. Any exits, obviously. And then where they keep their medication carts, where they keep their treatment carts, etc. All of this they should go over in the orientation. Depending upon the facility and the school, they might want you to know where the emergency shutoffs are for the water, electricity, and gas. Some schools don't require it, some schools do. You're going to want to learn any codes that they might call over the intercom from your instructor, from the site, whatever. But that's kind of the orientation you're getting. And then they'll show you where the patient rooms are and all of this other stuff that would be more site specific. After you've done that, typically what they do is they give you a break, you come back, we're all excited to start our first day. They usually pair you up with a staff member. So 1 or 2 students would go with one staff member, and you follow them around for the day. This would be something that would happen when you very first start nursing school. That way you're not totally abandoned. But you have to keep in mind, you can't have, if you have a group of 15 students, depending upon which school you go to, the number of students would be different. There's one of me, and there's 15 of you. I can't be constantly telling you where this is, and this is, and this is. I'm going to be supervising, but I need you to be with a staff member maybe the first day so you can find where do they keep the washcloths, where do they keep the soap, that kind of thing. So you usually get paired up with a staff member, not always, but typically I would say you do. And then as your days progress in clinical, you become more and more independent and you move towards taking care of a patient entirely by yourself. There's always going to be some sort of a policy and procedure regarding what work you can do by independently, or what you need your instructor there for, or what you need a staff member there for. So a common thing would be you need a staff member if you're going to transfer somebody. So if they're laying in bed and you want to get them in a chair, you're going to make sure that you have a staff member in the room to witness it, so that if that person falls, liability-wise, we're covered because, oh, that staff member was there and didn't help, or that staff member was there and helped and it's their fault that it happened. One thing to keep in mind in all of this, you're a guest in this clinical site's home, so you're going to treat them like you would if you were a guest. I'm not going to go and just use all of their materials in the sense that I'm not going to go, oh, there's a printer, I can use it. Oh, there's a water fountain, I can use it. Always ask, be respectful, go out of your way to be nice, because it's a privilege to be there and not a right. People get kicked out of facilities frequently, and you don't want to be the cause of that. So just as a student, just keep in mind, I'm going to be as respectful as possible. If I want to use something, I'm going to ask versus going straight and just doing whatever I want. The exception would be supplies you need for patient care. If you need a gown because it's an isolation room, you don't have to ask. You can put that gown on. And just, to ask your instructor about that kind of thing. But you should be able to use any supplies that you need. If you need a washcloth, you should be able to use it. Usually at the end of the day, towards the end of the day, you've been following this person around, you're exhausted because it's the first day. Then everybody wraps up with a post-conference. Every day of clinical, there's always pre-conference and post-conference. The first day, because it's orientation, you're just getting your bearings, they may not have the pre-conference. But it'll be something where, here's what we're going to learn today, here's what we're going to do, and you get kind of your assignment for the day. But the post-conference of the very first day of clinical typically is, are there any questions? Were there anything you couldn't find? Was there anything you learned? This is not other people, but my personal preference for day one is to ask people, what did you have unexpectedly? What happened today that you weren't expecting and you didn't think you'd see and you saw? And so I've got the whole range of, I saw a naked woman and I wasn't expecting that, somehow even they're giving her a shower. All the way from that to, I saw a wound so deep I could stick my whole arm in it. You just never know. And I like to let students kind of process that with me. You can do that with your friends after clinical. You just want to keep it HIPAA compliant, where I'm not going to go screaming patients' names after clinical. I'm not going to go screaming any identifying information. But if you're just saying there was a really deep wound, that should be vague enough. It's not going to break HIPAA. So HIPAA applies to you as a student as it would to any healthcare worker. I can't write on my clinical notes this person's full name, their date of birth, and then take that paper out of the clinical site and home. So if you're doing some clinical paperwork where you need to take some information from the charts, initials max. If your instructor asks for different information, you can, verify this is what you would like me to do before you do it, but you don't want to have full names and date of birth on your clinical paperwork that you're taking home with you. Typically the first day or the second day, I try to err on the second day, you're going to actually be picking your own patients and follow that person throughout your clinical journey, at least while you're still at that site. Usually they rotate. You're not going to be there forever. That you might want to keep in mind. See which patients you like. If you want to ask for anybody in specific, oh, I gave a bed bath to this woman, I really like her, is it possible I could take her on as my patient? A lot of instructors will let you pick, especially on the first day of clinical. Okay, lastly, that's your clinical day, but now it's the night before and I'm nervous and I'm worried and I can't sleep. What do I need to do? Best piece of advice I can tell you is to prepare the night before. Get a bag, a box, something like that, and put all of your clinical items in it. So that'll be your clinical box moving forward. You're going to put your badge in that box. You're going to put your blood pressure cuff in that box. You're going to put your stethoscope in that box. If your school gives you a pen light, you're going to put the pen light in that box. Everything in that box except for maybe your scrubs. So when you wake up in the morning, you take your shower, get ready, put your scrubs on, and you take that box, bag, whatever. Oops, falling off the deck. Okay, so you're going to take that box with you so that every day you don't forget your badge. Because if you don't have your badge, you can't be let in the clinical site, and they'll often send you home because you need proper identification. So if you always leave it in this box, you leave it in there the first day, you wake up in the morning, you put it on, you go to clinical, you come home, you take everything out of your pockets, put it in that box, you take your badge off, put it in that box, you're never going to lose one thing. You're not going to forget the entire box usually. It would just be your pen or your badge. So come up with some sort of a box, some sort of a localized area you're always going to put your clinical items in. The second thing I would prepare is some sort of a small notebook, paper. Even if your school doesn't require it, I would bring something so that you can write all your notes on, write on things you want to look up. So I don't remember how to do a bed bath. It's usually something that happens to people day of. You just get nervous, your mind goes blank. So you're going to want to write that in your notebook while you're there. So when you come home, you can go over the procedure again and be more prepared for day 2. So get a bunch of pens ready and get a notebook ready. I would get extra pens for the first day. You don't want the pen to break halfway through the day or run out of ink or something, and then you just can't write for the rest of the day. So I'd bring at least 2. And then put everything else in that bag and be ready. The biggest thing I would say for clinical is you're going to roll with whatever punches they're going to give you. It's always going to be a weird day. I had an orientation with a group at one facility where a resident actually passed away soon before we got there. So we ended up spending half of the day locked in this one room where they told us, we don't want you to leave out of respect for this patient. I think they're actually called residents there. Out of respect for this resident, you're going to stay in there. And when we're ready to have you come out and start orientation, you can come out. And I think we were in there for 3 or 4 hours. And then I just said, can we go to lunch? You never know what's going to happen. So just prepare for the unexpected. Everybody gets through it. I got through it. You'll get through it. Your instructor gets through it every single time. You'll survive. So just deep breath and you'll be okay. If you're really worried, you can try to get ahead on homework the night before, anything to just kind of ease your mind, but everybody gets through it. You're all going to be okay. The only thing I guess you can probably prepare for ahead of time, if you've never ever been in a nursing home, a lot of the clinical sites are often nursing homes. That's where we teach our students often, just because the elderly are a little bit more willing to accept like students working on them. There's a lot more rotations. We can have you work on them. Maybe peds or maternity, you'd actually go somewhere else. But for the generalized population, nursing homes are great. They have all of the problems we're learning about in class often. If you've never been there, what you can prepare for the night before is, what are you going to do when you walk into the room the first time and you see somebody, an actual live patient laying in that bed? What I mean by prepare yourself is come up with some sort of a conversation. Think of some safe topic to talk to this person about. They may or not be able to reply to you. They may or may not be in a good mood. They may or may not look mildly disturbing to you. And what I mean by that is they might look emaciated and half unconscious. They might look like not what you're expecting. So come up with some sort of a plan ahead of time with how you're going to deal with that situation so that you don't say anything appropriate when you start your first day. Any patients you walk into, always pretend they're completely conscious, they can hear you, and they can understand you. even if they can't, even if you know they can't, because you never know what the circumstance would be. You never know who is listening. I don't want to say anything to a patient that would offend them, and I expect other nurses to do the same for me. A good example would be, so they smell really bad. There's a very strong smell of feces. You don't want to go in the room and say, oh, this really smells. Do you want to be laying in bed and have somebody tell you you smell and there's nothing you can do about it? You just kind of have to sit there and deal with it. Maybe you can even smell it yourself. No, you want to make them feel as respected and dignified as possible, and you're going to go in with that smell. And usually, it's COVID, you're going to have that mask on. You're just straight face behind the mask. Don't let your eyes show anything. Just, yes. If smells really, really affect you, you can get some essential oils and put it on the outside of your mask. I recommend the outside, because when you put it on the inside, you can kind of choke on it sometimes if the smell's too strong. Peppermint's the most famous one. I don't do peppermint personally. Something about it, I don't like it. So I use other oils. I've used everything from orange oils to different fruits or whatever makes it work for you. They also have some stickers you can actually put on the outside. Usually you can get them from Asian markets, that have kind of a eucalyptus-y kind of scent that can kind of help with it. If you're strongly affected by that, that's something that some students, I think, are not prepared for when they're going to clinical. You have to deal with the smells and be totally straight-faced and completely professional. Lastly, think about ahead of time what you're going to do for lunch, because there are some clinical sites that have a microwave they can provide you or a small refrigerator or something, but often they don't. So I would highly recommend getting a small bag with a sandwich for day one, because after day one you'll know what they have, but beforehand you have no idea. You need something that doesn't need to be refrigerated, doesn't need to be microwaved, and you can just eat as is. A sandwich would go pretty good anywhere. I can't think of any clinical site I've been to that wouldn't work. It's always better to carpool if you can, and you can get there still early, because then you have other people that can help you find the site. That's all I can think of, really. Might make subsequent videos if I can think of other things, but just take a deep breath and realize that all of us get through the first day of clinical, and you'll get through it too. The biggest thing is just resting, preparing yourself mentally, and showing up, really. There's nothing you can work on. There's no room for improvement. You're not expected to be the perfect nurse day one. You're expected to start day one. So just think about that as much as you can and try to get some sleep. Usually they're early. Try. Give yourself some, credit for whatever sleep you can get. Okay, so I'll let you guys go. Good luck. I'm rooting for you too.